Sepsis is the body's extreme over-response to an infection, and it can lead to tissue damage, organ failure, loss of limbs, and death. The risk of death rises every hour that treatment is delayed, so your ability to rapidly detect the signs and symptoms could save lives. So who is at risk? Elderly patients are at risk of sepsis, as well as people with a weakened immune system, long-term medical conditions, skin damage such as cuts, blisters or ulcers, or people with catheters. Infections from bacteria, fungi, parasites and viruses can lead to sepsis, with symptoms emerging a short time after infection. This also includes coronavirus infection, so it is particularly important to familiarise yourself with the signs of sepsis during the COVID-19 pandemic. What are the signs of sepsis? A high temperature or fever is the most common sign of sepsis, though some people will have a low temperature or hypothermia. Although this observation is important, temperature alone should not be used to identify cases. You can look out for the other signs of sepsis by using the mnemonic SEP-SIS. So that is slurred speech, extreme shivering known as rigors or muscle pain, passing no urine in a day, severe breathlessness. Septic patients often report that they feel as though they may die. And look at the skin. Is there discoloration or mottling? So that's purple, red or patchy areas which may look like this. Do they have a rash that doesn't go away when you put a glass on it, which is known as a non-blanching rash? And have their lips, skin or tongue turned blue, which is known as cyanosis? In addition, some septic patients experience extreme pain, confusion, or an increased heart rate, though this is not always the case for elderly people who may develop an irregular heartbeat or arrhythmia, or a very slow heart rate in response to severe infection. Spotting difficult cases. Sepsis can be difficult to spot. Signs may be subtle, non-specific, and non-localized. They may just be feeling extremely unwell, and patients who are elderly, frail, or have weakened immune systems may not present with a high temperature. You should therefore look for other signs that their health is getting worse, such as general malaise, which is a feeling of discomfort or unease, agitation, and behavioural change, such as not acting their normal self or eating or drinking less than usual. For this reason, it is recommended that you pay particular attention to the concerns expressed by the person or their family, as they may be much more likely to notice symptoms that are out of character. If you see any of these signs and symptoms, think, could this be sepsis? Assessing risk. When you suspect sepsis, the patient's status needs to be reviewed urgently. According to the National Institute of Health and Care Excellence, this includes taking their vital signs to identify their risk. This involves taking their blood pressure, heart rate, breathing rate, mental state, temperature, and level of oxygen in the blood, if possible, and using a sepsis risk tool, such as NEWS2, to assess the risk to their health. This will allow you and your team to rapidly assess the situation. Find out more in the further reading section at the end of this module.